Nasal sprays. Allergies can be rough, depending on the season. Just because you have allergies doesn't mean you have to suffer. Many medications in the world can help with seasonal allergies. One route of those medications that are highly effective is used through nasal sprays. Nasal sprays are a type of medication that is administered through the nose. They are made to spray or mist a small amount of medication straight into the nasal passages, allowing for fast bloodstream absorption. Allergies, sinusitis, nasal congestion, and nasal polyps are just a few of the problems that can be treated with nasal sprays. They might include antihistamines, decongestants, corticosteroids, and saline solutions, among other kinds of medicines. By preventing histamines from being released into the body, which is what cause allergic symptoms like sneezing, itching, and runny noses, antihistamine nasal sprays are used to treat seasonal and year-round allergies. Azolastine and olopatadine are two examples of antihistamine nasal sprays. Nasal decongestant sprays work by constricting the blood vessels in the nasal passageways to reduce nasal congestion. In general, these sprays shouldn't be used for more than 3 days at a time because continued use can cause rebound congestion. The nasal spray decongestants oxymetazoline and phenylephrine are two examples. Nasal sprays containing corticosteroids are frequently used to treat allergic rhinitis, nasal polyps, and other nasal problems because they help to reduce nasal inflammation. They reduce the body's production of specific molecules that trigger inflammation. The corticosteroid nasal sprays fluticasone, budesonide, and mometasone are a few examples. Saline nasal sprays are used to moisten and clean the nasal passages as well as to assist in reducing nasal congestion. They are made of a salt and water combination. Additionally, they can be used to clear irritants and allergens from the nasal passages. All ages can use saline nasal sprays, which are safe for long-term use. To maximize any potential negative effects and assure the efficiency of nasal sprays, correct application is crucial. Never share your nasal spray with anyone else, and always adhere to the advice of your doctor or pharmacist. Speak with your healthcare practitioner if you encounter any negative effects or if you have any concerns about using nasal sprays. The correct way to use a nasal spray may differ depending on the medication being used and the recommendations of your healthcare provider, but generally speaking, you can follow these steps. To remove any mucus or debris from your nasal passages, gently blow your nose. Unless your doctor instructs you otherwise, shake the nasal spray bottle vigorously before using it. Your thumb should be at the base of the nasal spray bottle, and as your other fingers should support the base. The nasal spray nozzle should be inserted into your nostril while tilting your head slightly forward. With your finger, cover the other nostril. Aim the nozzle a little bit away from the nasal septum, the tiny tissue wall that separates the nostrils. As you start to breathe in slowly and evenly through your nose, squeeze the bottle or apply pressure to the nasal spray pump to release the medication. Spray, then gently exhale through your mouth. If your healthcare provider instructs you to repeat these procedures for the other nostril, replace the bottle's cap after cleaning the nozzle with fresh tissue. Wait a few minutes between each nasal spray application if you plan to use more than one to give the medicine time to work its magic. It's crucial to adhere to the detailed instructions included with your medication, and if you have any questions or concerns about using a nasal spray, talk to your healthcare provider or pharmacist. Thanks for watching. Don't forget to subscribe.